Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today's episode, I'm joined by Fay Rotenberg, the president and CEO at Firefly Health. How are you today?
Hi, Jared. Great. Happy to be here.
Yeah, excited to have you on. You and I were able to catch up a little bit at the health conference in Boston, which was a ton of fun. A lot of great conversations, a lot of great networking, and overall good conference. Did you have a good time at it?
I did. It was like little mini dopamine rushes every time I ran into people I hadn't seen for 2 years.
And it was basically in your backyard, right? Like you were able to, there was not even much of a commute for you.
It's true.
Well, I'm excited we were able to link up there and then get this scheduled. So I'd love if you could quickly tell the audience a little bit about your background, and then we'll talk more about Firefly Health and some of the things you're building.
Absolutely. So I'm leading Firefly Health. My background is really a mixture of venture capital and operational experience. So I've led 2 other companies. One of them was squarely digital health, and the other was really a tech company selling into healthcare organizations, and have been on the investor side. So investing at both early stage venture capital firm and then more of a growth equity firm, investing into healthcare technology.
And what was it, kind of shifting focus to Firefly? What was it with Firefly that made you like, I want to be a part of this. I want to, lead this team. And what was it about the opportunity? And this is kind of going to tie into, I always ask the why, how, what. So if you could transition into that, but I'm curious about kind of what drew you to the company.
Yeah. So when I first met the 2 co-founders, when it was really an idea, Andy and Jeff, what appealed to me is I saw Firefly as the tip of the spear for eliminating so much of the bloat in our healthcare delivery system. And the vision that appealed to me was the idea of truly restructuring the way that care was delivered to meet the needs of today's population. So the vast majority of death, disease, and costs are driven by behaviorally driven conditions, things that take continuous proactive touch points and can't be addressed in any one visit, and often can't be addressed in the physical system. So the original premise of Firefly was to restructure the way that care is delivered through the lens of a virtual first advanced primary care model that breaks down the boundaries between primary care and behavioral health care, between primary care and specialty care, and blows up the idea of the annual physical. So rather than just seeing your PCP once a year, how about talking to them constantly throughout the year? And actually, moving people towards a model that produces better health, much better outcomes, and reduces a lot of unnecessary costs within our system. And so that's what hooked me. And that's why I joined originally as president, and then I became CEO. And we've been realizing that vision and have really expanded upon it as well.
Yeah, and really, when people think Firefly Health, from the conversations that when you run into people, and they talk about like, well, what are they doing? Everyone always says, kind of leads to, well, they're building the virtual first, Kaiser. Do you agree with that statement as well?
I like that analogy a lot. And I think that where that comes up, especially the Kaiser part, is that Firefly right now, we're launching a health plan built around our care delivery model. And as you know, Kaiser has a health system and then they have a health plan attached to it. And Firefly, while we started with virtual primary care at our core, we've continued to build out more and more specialty care directly on our platform, both individual, virtual specialists, centers of excellence, other condition-specific digital health partners, complemented by physical facility partners. So we recognize not all care can be delivered virtually. And so we are navigating from virtual to physical seamlessly and building out what I consider a virtual first health system. And then what we've done recently, and it launches in January, is actually built coverage or a health plan around that care delivery model. And I think that's where the comparison to a virtual first Kaiser comes in.
Yeah, it's definitely. I was super intrigued by what you're putting together and just the team that you're putting together as well. Can you talk us through a little bit about like how this structure that you're putting together will actually help reduce costs?
Yeah, absolutely. So, I love to think of us as Marie Kondoing the healthcare system. We're taking out a lot of the unnecessary bloat, a lot of unnecessary visits, and really only keeping the things that produce a better experience and better outcomes. When you actually get down to how we are reducing costs, and I should say that our mission is half-priced healthcare that's twice as good clinically and emotionally. In many ways, we've been able to prove out that twice as good clinically and emotionally. Our NPS is between 75 and 91. Our chronic conditions are at least 30% greater than the commercial averages. So we have that. And while we're not half price, we are about 20 to 30% less expensive than commercial averages for other plans. And a lot of that is coming down to utilization and unit costs. And, it's unnecessary utilization. So whereas many plans, the only lever they have to reduce costs is to keep people away from care, we're doing the opposite. We believe that we're trying to get people to get as much care as possible, as much virtual care, as much Firefly guided care as possible. And we believe that will actually result, and we're seeing it result in lower downstream costs. So we're reducing unnecessary ER utilization, significantly reducing ER admissions. We're reducing unnecessary specialist visits, either by doing e-consults ourselves with the specialist, pulling in a specialist directly on our platform, and negating the need for that visit altogether. And then unit cost comes down to navigation. So on average, our members are engaging with their care team about 45 times per year, which means that they're constantly turning to us as that first place that they go to for anything. I like to think of us as the Jiminy Cricket that's always on your shoulder. You have your personal care team, you need anything, you turn to us, and we'll guide you to care, either keeping you out of unnecessary things or resolving issues immediately. But we're able to guide to, I would say, the higher value partners. And that's where unit cost comes in. We're also reducing admin costs significantly and reducing prescription spend by about 20%.
And that's great, by the way. And I love the kind of, Jiminy, what is it? Jiminy Cricket? Yeah, Jiminy Cricket.
I've been amazed how many people actually don't know what I'm talking about.
I can picture it. I remember seeing, you see it in in what is it, cartoons growing up and things like that. Yeah, but I like the way that you used it. I've never heard anyone use it in that way. So that's really
always on your shoulder. It's your little buddy, always there.
I like it. Why? Can you talk a little bit about why virtual care matters? I'm a believer. I feel like more and more people are believers today, and we need more virtual care, and virtual care is really where a vast majority of our care is going to be heading. But can you talk through just why it matters to Firefly and why you think it's going to continue to grow?
Yeah, so I think it matters on several dimensions. I think one is that always on aspect. And so the fact that you can always have a care team by your side. So with Firefly, everyone that joins, you have your own personal care team. You have an ND, an NP, behavioral health specialist, a health guide, and they're always there. And so you're breaking down barriers to access by having that virtual presence and the continuity of your own personal team that's by your side. So I think virtual care matters a lot for access. It also matters a lot because you can resolve most issues virtually. Many things do not require a physical visit. And I think that there has been a false assumption that you need an annual physical. There's actually a lot of research that you don't. And what you do need is you need intervention at certain points in time. And you're actually able to predict that without needing to go in for a physical visit. I think what is important, and while you can get a lot done virtually, it's really important to have places to go when you need physical care. And everyone will need to see someone physically at points in time. And where I think that there has been a problem with the way a lot of virtual care has been conceived to date is you're really just solving for convenience, which I think is just scratching the surface. So you're just using virtual care as a way to be seen quickly, and it's convenient, but you're not actually providing value, and you're only replicating the existing fee-for-service visit-based system. And what we're trying to do is actually restructuring the way that care is delivered altogether. So most visits don't need to occur. And whether you have them virtually or in person, it's not going to matter. You can replace visits with care plans, with continuous chat interactions with your care team. And I think that's really how you move the needle in terms of delivering real value and outcomes for your patients. But it's also important that when you do need hands on you, that you have a place to send a member, and that the patient can actually go get seen by a specialist and still throughout that journey have their care team by their side. And I think that that's where the Firefly magic comes in, and the magic of our network comes in, where it's really stitching together the virtual and the physical. And it's using the virtual as the first line, and we're able to resolve a lot virtually, even outside of a visit. But whenever you do need to be seen physically, we have that option for you as well, and we will guide you throughout the process. We'll direct book you. We'll ensure that you're in, within a really short period of time, and as soon as you walk out, you're hearing from us, and we're helping to manage that continuity.
I really like that approach. Yeah, and I agree with you that, well, number one, a lot of people don't go and get physicals. Partly because they don't want to go in to
Right.
a location, but then there's also reasons where people go and get one and it's like you really didn't even need one. Maybe you just
Yeah.
needed that virtual visit just
Right.
for a check-in. So I like that approach.
And you
Uh,
want the relationship. And if you can build a relationship with your care team and your clinicians outside of a visit, that's even better.
yeah, because that's still. I mean, it's still difficult. Like a lot of people don't do that well too. So like if Firefly is continuously able to do that and build that strong relationship, that's going to be great for. It's going to mean great things for your patients, but it's going to also mean great things for what you're continuing to build.
I believe everything comes down to trust. And if you build trust with your patients and your members, and I believe you do that through relationship, which is actually built through these continuous touch points. If you're saying 45 touch points a year, our members are engaging with their care team, it's 45 opportunities to build a relationship. And that's how you earn the right to navigate. People are only going to turn to you if they trust you. And then if they trust you to navigate them, that's where you can not only ensure that they're receiving great care, but you can also drive a lot of those downstream savings.
Absolutely. Uh, Faye, before we wrap things up, I always ask what's next to everyone that's coming on. And I know you already alluded to some stuff happening in January, and you mentioned actually a
Mm-hmm.
couple of what's launching. But can you also share anything else, like what's next for the company? What are you most excited about? And then we'll wrap things up.
Yeah, I'm excited to be launching our health plan and continuing to have that grow in additional states, and really just furthering our mission of half price healthcare that's twice as good clinically and emotionally, and hopefully having more people be able to realize that across the country.
Well, I'm excited to continue to stay in touch with you. Hopefully, we can have you on again soon, and other members of the team, but also just follow the Firefly Health journey. Congrats on all the success
That's
so far.
perfect. Thanks so much, Jared.